So the MANIFEST study is a 3-arm study of Pelabresib, which is a oral pan-BET inhibitor. The first arm are patients who have failed Ruxolitinib and no longer on it, and they get monotherapy Pelabresib with endpoints that are centered around whether they are transfusion dependent or independent. So transfusion dependent patients, the primary endpoint is transfusion independence, and patients who are transfusion independent, the primary endpoint is the classic spleen volume response, 35%. Arm 2 are those patients who are receiving Ruxolitinib and have a suboptimal response, and Pelabresib is added to Ruxolitinib, and the same transfusion dependence, independence, or spleen volume response as a primary endpoint. And then Arm 3, which we'll be presenting at EHA, is JAK inhibitor-naive patients who receive both Pelabresib and Ruxolitinib concurrently. Pelabresib is delivered at 125 milligrams by mouth for 14 days out of a 21-day cycle, and Ruxolitinib is delivered twice a day based on the dose based on the platelet count. What we've seen with this study is that the combination is very potent in spleen responses. So we've had spleen volume response rates of 35% or greater in approximately 68% of patients. And that is favorable when compared to a number of prospective studies of Ruxolitinib alone, in which the response rates are around 30 to 40%, as well as a median reduction in TSS 50% of about 57%. So the combination clearly drives significant spleen and symptom benefit. The toxicity profile is quite favorable as well. There are low-grade GI toxicities that rarely lead to study discontinuation. There is thrombocytopenia and anemia that's treatment emergent, although it appears to be less so than Ruxolitinib alone. And we've previously shown that the nadir of hemoglobin with the combination seems to be less accentuated than Ruxolitinib alone. And we've seen about 30% of patients have at least one grade reduction in bone marrow fibrosis as well. There'll be some very interesting correlative data that's presented that demonstrates changes in patterns of cytokine groups. And we will be linking changes in cytokine profiles to responses. All of this data collectively endorses the randomized phase 3 study, which is MANIFEST-2, which are patients who have intermediate and high-risk disease with spleen and symptom burden and are JAK inhibitor naive, and they receive either Ruxolitinib alone plus placebo or Ruxolitinib plus Pelabresib at 125 milligrams for 14 days out of a 21-day cycle. And the primary endpoint there is spleen volume response. Secondary endpoint is TSS. And a key secondary endpoint is duration of response. We want to ultimately see that the combination extends the benefit of JAK inhibition beyond the median of 3 years that we see with Ruxolitinib alone. Additionally, we will be looking at other biomarkers like reduction in bone marrow fibrosis, reduction in driver mutation level, and reduction in key inflammatory cytokines.